Hi guys, it's Dr. Sal from DrSecrets.com. Thank you so much for joining in. Today we're going to take a look at how to read your doctor's prescription. Now, this is just a fun segment for those of you who are nosy and would like to be able to read prescriptions that are proffered to you. Do not ever try to write a prescription and pass it to a pharmacist if you are not a licensed MD. That is a criminal offense. That being said, we're going to use this this illustration here of prescription so I can teach you what it is that we're actually writing. Now, typically on the prescriptions, there'll usually be a header, which is something printed out or stamped out by a machine, and that usually will have the name of the clinic where it was derived from. It will have contact information like our address, fax number, phone number. That's in case the pharmacist queries something on the prescription or notices an error or mistake or potential interaction and they want to get hold of the prescribing physician. They need that contact information to be able to get hold of us. Of course, then there's also a date, largely because if I give you a prescription today and you decide to hand it into a pharmacy 2 years from now, it is considered invalid. Prescriptions are typically only valid for a year for some things, and for others, sometimes a month is as long as they'll be good for. So the date is also a critical component. Obviously then, you also have to have the patient's name. In this case here, this is just a joke prescription, so it's called John Doe, but it would be whatever the individual's name was. All right, then we get to the main body, which is the actual information which the pharmacist is relying on in order to fulfill the prescription. So in this case here, I'll just read it for you. It says Rezapine 0.25 milligrams, 100 tablets, once a day for blood pressure. So slowing that down a little bit, the first piece of information is the name of the drug. So this could be this drug, or it could be amoxil for tonsillitis, or it could be, what else? Geez, there's so many different drugs, it's almost hard to think of just one. But any drug you could think of, say aspirin, Advil, Motrin, Tylenol, morphine, whatever it is, you start typically with the name of the drug first, which sets the context, and then all the other information after that makes more sense and keys into it. So the next step then is to say the potency. So in this case, it's 1/4 milligram. And drugs can range from anywhere from milligrams to micrograms. Typically, it's very unusual to see a gram dose of any drug, but there are a few drugs where it could be a gram. But most drugs are measured in milligrams to micrograms. Then there's also the question of the number of pills. In this case, the fake physician has written here number of pills 100, but more often in practice we will actually write a duration, not a number of pills, and let the pharmacist figure out the number of pills. So if you see something like an X here and then it says 1/52, that means for 1 week. If you see an X here and then 1/12, that means for 1 month, etc. So that's for duration. The other thing that's a little bit odd with this prescription here is usually when I've seen prescriptions, and the ones I do for myself, we usually put the duration at the end of the line rather than in line. Anyway, I guess is just a preference. So typically it would go from the milligrams here and then say how many, how often. So it would say this little symbol here, this dwarf T with a dot on the top, is just a nomenclature that means 1 tablet. If you see something that looks like the figure pi, so 2 with a crossbar on top and then 2 dots on top of that, that would mean 2 tablets. And it continues like that, 3 tablets. Usually when it goes to 4 or 5 tablets, which is unusual but sometimes will occur, we'll start using Roman numerals. So we actually do the 1 and the V or V, etc. And some physicians will actually just write it out. They may just say one, O-N-E, for example. Then this next hieroglyphic here is telling you how many times a day. So it's one tablet, how many times a day. In this case, it's OD, which means once daily. Other common things would be BID, which means twice daily, TID, which means 3 times a day, QID, which means 4 times a day. Don't ask me how they got those abbreviations. It's probably from some kind of Greek. And then after that, after 4 times a day, then we typically break out from that nomenclature and move into actually specifying how many hours between. So we might say, instead of the OD, BID, TID, QID, we might then say instead PO, which means oral. That's another thing missing from this prescription. We always say the route as well, because drugs can be intravenous, so then we would say IV, intramuscular as an injection, that would be IM, and then PO means by mouth. A lot of the time for community-filled prescriptions, it's automatically assumed that it's going to be PO, because typically nobody's going to send you home to give yourself your own injections in the muscle. In a hospital, on the other hand, you have to specify the route. So I'm guessing on this prescription here, as it's supposed to be mimic of a community prescription, the PO part is missing. Anyway, traveling back to what I was getting at in the first place, the OD, BID, TID, etc. You can also specify how often. So sometimes we'll write Q, a capital Q, and then say 2 hours, for example. So we might say Q2HS, sorry, HR, or HS. But actually, HS has a specific meaning for us. HS for us usually means at bedtime or nocturnally. So we've looked at name, quantity, how many, how often, and then duration and route of administration. This piece here, this for BP, doctors don't have time typically to be writing nonsense like that. So this is obviously a fake. The pharmacist also is no idiot. The pharmacist can look at the name of the drug and know what the indication for the drug is. So this part here is totally fictitious. No self-respecting physician would actually write what the reason for the drug is. Everybody on board is a professional that knows what they're talking about. And then the final thing of the prescription is obviously a signature. The signature of the prescriber is a legally binding document which authorizes the pharmacist and pharmacy to fulfill that. It's almost like a contract to fulfill the prescription of the medication to the individual, which may be you or whoever. So that, ladies and gentlemen, is how we write prescriptions. And as you can see with the volume of information, just to write something as simple as penicillin. So for example, if I was going to write penicillin, what I would write here is an abbreviation. I would write PEN and then VK, so penicillin. Then I would write the dose, 300 milligrams. Then I would write 2, so the pi with the T on top, 2 dots, 2, and then I would have PO, and then I would have BID, and then I would have a big X, capital X, and then I would have 1 over 52, or I might actually write 1 week. So you should, based on everything I just taught you, you should be able to interpret what I just said verbally there and turn it back into what it was meaning to fulfill. So that, ladies and gentlemen, is how we write prescriptions. And as you can see from the volume that we have to write, that is part of the reason we have such horrible handwriting. And I actually put another video up here on why doctors have bad handwriting, which you might also find amusing. Thank you for watching. And don't forget to subscribe so I can keep you updated as I upload new videos. Thanks again. Have a great rest of your day.
Thanks for watching. Get notified of new videos. Subscribe now.